Shivering at 3 mysterious stories of 3 young women because of abortion. Abortion is no different from murder, because it blocks the way of life of an innocent being. Then the innocent child's soul will follow the guilty mother and cause them to suffer a lot of heavy karma, like the 3 young mothers below. Kaohsiung City Hospital, China recently received 3 cases of infertility for a long time despite worshipping from all directions. Through a review of the records, the doctors discovered that all 3 of these people had had previous abortions. The first case is a 24-year-old woman surnamed Lam. Ms. Lam, after a few years of marriage, still can't get pregnant. Through abdominal ultrasound examination, doctors found a foreign body in Ms. Lam's uterus. However, Ms. Lam said she had not had previous surgery and had not placed any foreign bodies in the uterus. After a closer examination, the doctor discovered that it was a tiny piece of fetal bone left in Ms. Lam's uterus. It turned out that 6 years ago, Ms. Lam was pregnant and aborted when she was 4 months old and left this remains. The second case is a 26-year-old woman surnamed Lee. The patient often had irregular bleeding and had severe dysmenorrhea, was weak, pale, and very tired. After asking carefully, it turned out that Ms. Lee 4 years ago had had an abortion. Doctors did an ultrasound of Ms. Lee's abdomen and found a foreign body in it. Ms. Lee had to have surgery to remove the foreign body. Doctors removed 7 bones of the fetus left in her abdomen. After the surgery, the irregular bleeding and dysmenorrhea stopped. The third case is a 20-year-old woman. This person is also infertile. After examining the abdomen with ultrasound, the doctors also discovered the calcified remains of a fetus. The patient later revealed her pregnancy at the age of 13 and had an abortion at the 8th or 9th week. The statue depicts a grieving mother encountering the spirit of an aborted fetus. The story above is mentioned to advise women not to have an abortion. Abortion is not only a crime, it is no different from killing an innocent person's life, but it also causes unpredictable consequences. For example, the mother will be infertile or other diseases arise later. It is worth mentioning that the age at which intentional abortions most commonly occur in unmarried women is between the ages of 16 and 20. The female body under the age of 20 has not yet completed the reproductive organs, so if they are proficient in abortion, they are susceptible to health damage, even serious. Some cases of abortion also died due to excessive blood loss because of weak muscles. Some other cases after abortion will bear serious consequences later, such as gynecological diseases, infertility. Obstetricians warn that deliberate abortion is very dangerous for women, especially under the age of 20. The reason is because during the abortion process, it is possible that a part of the fetus is left, especially the bone. This will cause abnormal bleeding, severe pain during menstruation, and more seriously, infertility. Those who have had an abortion should seek medical attention immediately if they have any of the above symptoms. Women who have abortions more than 3 times face the risk of permanent infertility. Therefore, you should consult your doctor if you still want to have a baby after an abortion. Thus, science has become aware of the serious consequences of abortion. Not long ago, Nguyen Bao En, Dong Da, Hanoi, crossed the fence with his lover and accidentally got pregnant. In order to avoid scandal and affect the future, En went with his lover to a private clinic to perform an abortion procedure. After abortion, En had prolonged bleeding and fever. Unable to bear the pain, En had to go to the hospital to monitor and treat this complication. Doctors recommend that patients are not allowed to have an abortion with drugs or go to facilities that do not meet the conditions. If you want to remove an unwanted pregnancy, you should go to a public health facility that meets all medical standards. There, before carrying out an abortion, the patient will have a gynecological examination first and determine the gestational age, the status of the fetus, whether there is a malformation or not, from which it will advise and determine the methods to remove the pregnancy. Suitable. After the abortion, the patient will be instructed about the time to monitor and treat the symptoms encountered. If a surgical abortion shows signs of bleeding in the intimate area, the patient needs to go to the hospital to examine and monitor the health situation as directed by the doctor. Patients may experience some serious complications or pelvic disease after abortion. There are many cases where no hygiene or careful abstinence is easy to get infections, bleeding or menorrhagia. In case the patient has prolonged bleeding without treatment, the cervix is still open, the risk of genital inflammation is great. The most serious consequence is infertility later on. Some major complications after an abortion can happen to the patient. Uterine perforation, hemorrhage, cervical tear during the procedure. Adhesions of the uterus usually indicate a lack of menstruation, or may not see the return of menstruation. Remnant vegetables show prolonged bleeding, easy to be infected. Miscarriage. After aspiration and the fetal appendages are still there, continue to develop. Inflammation of the appendages, uterine cavity due to the sterility of the procedure, or poor hygiene afterwards. Menstrual disorders after curettage, abortion, usually menorrhagia. Obstruction of two fallopian tubes due to an inflammatory process that blocks the two fallopian tubes affects the future fertility of the woman in the future.